I think that our Living Well facility here is just a wonderful thing for seniors that hasn't been ever done before, anything like this, and it's so good. And everybody that comes in here seems to just love it, and that's what we want them to feel like.
Well, when you walk through the door, somebody's always there to greet you. If you need a wheelchair, they'll get you a wheelchair, whatever you need. They make sure that you're good to the place where you need to go, and give you a cup of coffee and a snack, and answer any questions they can. If they can't answer them, they'll take you someplace that can.
When they come in our place, it makes them feel like that it's not a regular doctor's office waiting room, that we care about them and we want them to feel like it's their home away from home while they're here. And I feel that way myself because I'm going to be a patient here myself. I've just transferred here. I was with HealthSpring for a long time, but now I'm with this facility.
5, 6.
It's a social activity even though you're coming to the doctor. If you're really sick, you go see the doctor. If you're not really sick, you just come for a wellness check, then you can stay and have coffee or talk or play games or play checkers with each other or see your old friends. Everybody knows everybody just about.
We came up with the Living Well Health Center. It's based on a concept that's known in medicine as the advanced medical home. This is where you bring all of the components of chronic disease management to the point of care to help support the primary care physicians. The key to disease management is the patient, and the patient has to have the proper tools and education in order to be successful. We provide medications and advice, but it takes more than what a physician can do in a typical practice to deliver all the aspects of disease management that we set out to achieve at Living Well. There are a lot of things that occur at Living Well that are satisfying for the physician. One is the pace. I mean, typically we're very stressed with our time. We can't spend the amount of time that we really like to with patients because of the volume that's coming through. Here, because of the pace, we can spend more time with the patient. And not only for disease education, but to fulfill the social aspects of the human aspect of the encounter, get to know more about them as a person and their family. And I think there's value to that. It's part of the art of medicine, if you will.
It's a clinic where we see patients for follow-up on chronic medical problems. We do their preventive care here. We do a lot of education. We have nursing staff who we have trained and have worked with to make sure that we are providing good education for both chronic diseases such as diabetes, high blood pressure, cholesterol, their heart issues, as well as working hard to do some preventive care. We spend a lot of more time with our patients here than we probably would do if we were in a regular clinic schedule where we've got lots of sore throats and colds and we have a very busy, full schedule. We've made more time here to spend with patients, but when we have time, we go up front and grab a snack, grab a cup of coffee, talk to family members. It works out really well.
When I leave Living Well every day, I feel like that I've made somebody feel better by maybe giving them a smile and being nice to them. And sometimes I think the seniors are kind of put on the back burner, and we don't want them to feel that way. We want them to feel like they're up front because they've lived a long life, they're special, and we need to enjoy that and make them aware that other people love them too.